Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and one of you just reached out to me and said that I didn't have a video about taking out third molars or wisdom teeth after orthodontics. I have ones about before, but not after. Oops. All right, so I will make that video for you. This is a really important video. And a lot of this is really going to just depend on your own personal philosophy and the way you were trained. So, look, I've read all the white papers, journal articles. We all know that in most circumstances, keeping third molars in does not cause orthodontic relapse as long as you wear your retainer. Okay, so that's the caveat there, as long as you wear your retainer for the rest of your life. So for that reason, I still recommend third molars come out. Also, there's a few isolated circumstances where they got to come out regardless. And those would be, to me, number one would be a horizontal impaction like this, okay? I've seen it way too many times where this guy is sitting around, it's abutting up against the second molar, and it causes damage to the second molar. Better safe than sorry, get that guy out. As well as if it's partially erupted and you're starting to get some pericornitis or some periodontal disease, this one maybe is not that bad, but something like that, that's a problem. That's got to go. I'm totally fine with you keeping an erupted third molar as long as it's in good occlusion. That means the bite is good and it has an opposing tooth. So see this one? There's no opposing tooth. So it can't be in good occlusion. There's no function to this. This has zero purpose. All this is going to do over time is slowly wiggle its way out, and it's going to get inflamed gums, and it's going to start hitting the bottom gum down here. So this needs to go. Goodbye. Get rid of that before it starts causing more issues. Remember, third molars, when they do eventually become infected, whether they're it's slowly super erupting and banging on the gums, they're partially impacted and they're having pericornitis, their food is coming down and getting them infected under the gum. When these eventually become infected, which they will, whether it's today, tomorrow, next month, next year, 10 years from now, it will blow up, meaning that it will be the most excruciating, intense pain you've ever experienced, and your whole face will probably swell up, and it becomes an actual life-threatening emergency if that infection travels to your brain or down into your airway. It can kill you, okay? It's not a joke. Sepsis too. So for that reason, if you have a non-functional or tooth in poor occlusion, it needs to go. For this scenario where it's impacted and maybe just bumping up against the other root, sometimes it's okay, sometimes it's not. I mean, worst comes to worst, you get an infection and you'd probably lose both these teeth. So, but I mean, it's a one-off. It doesn't happen all the time, but it does happen. And also sometimes that force as it's developing, the mesial angulated force can help to squish the teeth up a little bit more. But if your tooth is fully impacted under the bone, not bumping another tooth, not even peeking through the bone or the gum at all, it's probably okay to leave, especially if your orthodontics is done, because it's not like we're having to move around teeth around it. But keep in mind, weird things can still happen. So for me, I'm just a big fan of just getting them out. If you have the insurance, get it out. And usually the deadline for getting these out, where the risks outweigh the benefits, or the benefits outweigh the risks, where would be under age 25. 25 to 30 is a maybe. After that, they're not going to take it out unless it's a problem or unless we need to for orthodontics, and it becomes a much more severe dental medical procedure in order to get them out. So I'd rather just everyone get them out in college or before college. I think that's just a smart move, but your choice. We're not going to make you do it. At least you understand the risks. So that's the truth behind the truth. And I've had it, just speaking from an orthodontics perspective, for a while, my first few years in practice, I really stuck to my guns, and I went, it's not going to cause relapse. It's up to you, for those type of situations. And ultimately, someone wouldn't wear the retainers. They'd come back. There would be relapse, and then they blame it on me for not forcing them to get their wisdom teeth out, with not strongly encouraging it, And it's like, hey, whoa, this is what the research says. But I found that was really detrimental to my practice and to patient trust. And patients believe something, and they believe that third molars cause relapse, regardless of retainers or not. So it was just better to educate the patients and their parents and give the referral to everybody and they can make the decision. And the ones that were more serious, I definitely press on it a little bit more. Otherwise, it's, it's really up to you. If you want to, it's maybe a good idea. Now's a good time. So, all right, that's pretty much my scripting. Hopefully that helps. Thanks.